We're learning new details about a potential buyer for two Chippewa Valley area hospitals and their surrounding clinics after they announced their closures.
Oakleaf Medical Network has announced they'd like to buy the hospitals and save them from closing, and in turn saving thousands of people from losing their jobs and access to health care in the community. News 8 Now's Michael Germain spoke with Oakleaf officials this morning and has the latest. Michael.
Ken and Emily, Oakleaf officials say they have had a strong relationship with both Sacred Heart and St. Joseph hospitals for the past 40 years. They needed to find a solution for the problem not only for their patients, but to prevent a major healthcare crisis from occurring. Oakleaf felt the negotiation was something they needed to get involved with in order to save lives. The board of directors for Oakleaf Medical Network says they have not made a formal offer, but have offered to negotiate with HSHS.
The hope is that we can keep the service lines going during the negotiations, and then when April 21st comes around and they officially pull out, we can continue to maintain those service lines. That's the hope.
Det Barn adds it is likely most service lines will not be open right away.
But we have to make sure that we maintain the crucial ones to get us through this situation in the short term.
But the negotiations won't be that easy. One hurdle Oakleaf is facing is trying to maintain staff members.
Keeping the nursing staff, the radiology staff, all of that staff in place so that we can hit the ground running once it's past April 21st.
Representative Emerson from Eau Claire says this isn't a statewide issue. It is simply a national issue, where patients will still need to find care.
800 to 900 babies were planning on being born at this hospital this year. Those people are still pregnant right now. How can we absorb this into the other healthcare systems? What do we do with this?
She says these communities can simply not exist without major healthcare providers.
It's not going to be a question of if people are going to die. It's going to be a question of how many people are going to die.
Now, the biggest roadblock is whether or not HSHS will accept Oakleaf's proposal and start negotiations. Oakleaf gave HSHS a 48-hour window, which is up today. As of now, they have still not heard back. Ken and Emily?
All right, thank you, Michael.